Hello friends, this video will tell you about gallbladder. About definition. Gallbladder is a pear-shaped reservoir of bile. It is situated in a fossa on the inferior surface of right lobe of liver. Already, while discussing the anatomy of liver, we have told the liver has two lobes, right lobe and left lobe, and the liver has two surfaces, superior and inferior. This gallbladder is situated on the inferior surface in the right lobe of liver. It is a reservoir of bile. It is pear-shaped. The primary function of gallbladder is to concentrate and store bile which is produced by the liver. The stored bile is then released from the gallbladder as per need of the body. The primary function of gallbladder is to store and concentrate bile and release the bile into the duodenum as per needs of the body. In this image, you can see the gallbladder. This is the gallbladder. It is pear shape in structure. You can see the pear shape. It starts from here and ends here. This is the right lobe of liver and this is inferior surface. The gallbladder is situated in the inferior surface of liver in the right lobe and it has a fossa that is called a cystic fossa. About the location of gallbladder. It occupies epigastric regions, right hypochondriac region, inferior surface of liver and between quadrate and right lobes of liver. Here you can see the 9 regions of the abdomen. The 3 upper regions are right hypochondriac, epigastric and left hypochondriac. Here, this is the location of gallbladder. It occupies the right hypochondriac and epigastric region of the upper abdomen. Coming to the dimensions and capacity. The gallbladder is 7 to 10 cm long, 3 cm broad and it can store up to 30 to 50 ml of bile. Coming to the parts of gallbladder. It has 3 sections, neck, body and the fundus. About the neck, it is the narrower part and it tapers into the cystic duct. Body, it is a main dilated portion and that lies between the fundus and the cystic duct. Fundus, it is the bottom that protrude from under surface of liver. Here you can see the 3 parts of gallbladder. This is the bottom of gallbladder, that is fundus. This is the middle main dilated portion named as body. It is between fundus and the neck portion. The neck is the narrower part of gallbladder and that tapers or terminates into cystic duct. About biliary apparatus. The biliary apparatus collects bile from liver, stores in the gallbladder and transmits it to the second part of duodenum. The function of biliary apparatus or the biliary apparatus are those structures which collect bile from liver, store it and transmit to the second part of duodenum. It consists of right and left hepatic ducts, the common hepatic duct, the gallbladder, the cystic duct and the bile duct. About the structure of gallbladder we have just seen, and the following slides we will just see the remaining ducts of biliary tree. But the first duct of biliary tree, that is the hepatic ducts. There are 2 hepatic ducts, one from the right lobe and the other from left lobe. They are called right and left hepatic ducts. They emerge at the porta of hepatis from concerned lobes of liver. The arrangement of structures at the porta hepatis from behind forwards is the branches of portal vein, hepatic artery and hepatic duct. Here you can see the right lobe of liver, left lobe. And this is the area of called the porta hepatis. Porta hepatis is the area in the liver in the inferior surface from where 3 main vessels originate. Or there are 3 main vessels seen and those vessels are called the portal triad. The vessels are portal vein, hepatic artery and the hepatic ducts. About common hepatic duct. It is formed by the union of right and left hepatic ducts. It runs downwards about 3 cm and joined by the cystic duct to form the bile duct. Here you can see the right hepatic duct, left hepatic duct join together and form the common hepatic duct. Then it runs forward around 3 cm and joins with the cystic duct from gallbladder and become the bile duct. About cystic duct. Cystic duct is about 3 to 4 cm long. It begins at the neck of the gallbladder, run downward, turn to left and join with the common hepatic duct to form the bile duct. Already we saw this is the neck of gallbladder that tapers to become the cystic duct, or the cystic duct starts at the neck of gallbladder. It turns to right, run downward and join with the common hepatic duct to become the bile duct. The mucous membrane of this duct forms a series of 5 to 12 crescentic folds arranged spirally to form the so-called spiral valve of Heister. This is the image of cystic duct. Here you can see spirally arranged mucosal fold. They range between 5 to 10. And these are called the spiral valve of Heister in the cystic duct. The bile is formed by the union of cystic and the common hepatic ducts. The bile duct, the fifth important duct, is formed by the union of cystic and common hepatic ducts. It is 8 cm long and has a diameter of about 6 mm. The bile duct runs downwards and backwards and lastly behind or embedded in the head of pancreas. It comes in contact with the pancreatic duct and accompanies it through the wall of the duodenum. The course of the duct through the duodenal wall is very oblique. Within the wall, the two ducts usually unite to form the so-called hepatopancreatic ampulla or ampulla of Vater. In the structure, you can see the discussion we have done so far. This is the bile duct. This is the pancreatic duct. It join together in the head of the pancreas and to form the structure called the ampulla of Vater or hepatopancreatic ampulla. Here you can see the entire biliary apparatus and its ducts. The biliary apparatus consists of gallbladder, cystic duct, right hepatic duct, left hepatic duct, and joined together form common hepatic duct. This common hepatic duct joined with the cystic duct form the common bile duct. It runs downward and enters the head of the pancreas. And along with this we can see, or it accompanies pancreatic duct which comes from other parts of the pancreas together and join form a structure called ampulla of Vater here, and that empties into the second part of duodenum. This is the colored picture of biliary apparatus. Gallbladder, its cystic duct. See the spirally arranged mucosal fold. This is called a spiral valve of Heister in the cystic duct. Right hepatic duct, left hepatic duct, common hepatic duct. Both common hepatic and cystic join together, bile duct. Bile duct run downward, enters the head of the pancreas, and the pancreatic duct also accompanies bile duct in the head, join together and form the ampulla of Vater. This is the dilated image of ampulla of Vater, or it is otherwise called duodenal ampulla. It opens at a second part of duodenum at a particular place called a duodenal papilla, about which we have seen while discussing the gastrointestinal system. Coming to the sphincters related to bile and pancreatic ducts, there are three important sphincters. One, sphincter choledochus, sphincter pancreaticus, and sphincter ampullae. Here you can see the three sphincters. This is the common bile duct. See here the ring arrangement of smooth muscle, that is called a sphincter choledochus at the end of bile duct. This is the pancreatic duct. This is the end of pancreatic duct. There you can see the ring shaped circular muscle arrangement, that is called a sphincter pancreaticus. Pancreatic duct and bile duct join together form this space called that is called a hepatopancreatic ampulla or ampulla of Vater, around which you can see the ring shaped arrangement of smooth muscle, and that is the sphincter ampulla or ampulla sphincter of Oddi. About sphincter choledochus. Choledochus means bile duct. The terminal part of bile duct is surrounded by a ring of smooth muscle that we have seen in the previous picture. It forms the sphincter choledochus. This sphincter is always present. As a result, the bile formed in the liver keeps accumulating in the gallbladder and also undergo considerable concentration. When the food enters the duodenum, the specially fat meal, the sphincter opens. Which sphincter? The sphincter of choledochus opens, and the bile stored in the gallbladder is poured into duodenum. About sphincter pancreaticus and sphincter ampulla. Another less developed sphincter around the terminal part of pancreatic duct is sphincter pancreaticus. A third sphincter that surrounds the hepatopancreatic ampulla or ampulla of Vater is called as the sphincter of Oddi or sphincter ampulla. Here you can see the three sphincters. Common bile duct. At the end of common bile duct, you can see sphincter of common bile duct or sphincter choledochus, pancreatic duct, and at the end of which we can see sphincter of pancreatic duct or sphincter pancreaticus. This is sphincter of ampulla, which is otherwise called a sphincter of Vater. And this is the structure called papilla, duodenal papilla, where sphincter of Oddi or sphincter of ampulla opens into the duodenum. So far, we have seen the macroscopic anatomy of gallbladder. Now we enter into the microscopic anatomy. Microscopically, the wall of gallbladder has three layers: mucosa, muscular layer, and serosal layer. The mucosal layer is the innermost portion. It consists of a lining of single layer of columnar cells. These cells possess small hair-like projections called microvilli. This sits on a thin layer of connective tissue called lamina propria. The mucosa has tiny outpouching called rugae. The mucosa of gallbladder has a layer of columnar cells. This columnar cells has microvilli. Microvilli sits on lamina propria, and the mucosal foldings are called rugae. Coming to the muscular layer, it sits beneath the mucosa. This is formed by smooth muscle with fibers lie in longitudinal, oblique, and transverse directions. A distinctive feature of gallbladder is the presence of Rokitansky-Eshov sinuses. They are deep outpouchings of mucosa that extend through the muscle layer. The muscle layer seen below the mucosa, it has smooth muscle fibers arranged in three directions, and the distinctive feature is presence of Rokitansky-Eshov sinuses. The third layer is serosa. It is the outer layer. It covers the fundus of gallbladder and the surfaces not in contact with the liver. The serosa contain blood vessels and lymphatics. The outer layer is serosa. It contains blood vessels and lymphatics. This is the image of the wall of gallbladder. The outermost layer is called serosa. Below serosa, we can see perimuscular fibrous tissue. Next comes the muscle layer, where muscle fibers are arranged in three directions. Below that, there is lamina propria, that is a connective tissue, which is a part of mucosal layer. The mucosa consists of a single layer of columnar epithelium that is seen here, and the mucosal layer has foldings called rugae, and also there is microvilli. Here you can see Rokitansky-Eshov sinuses. This is the mucosal layer. This is the outpouching or herniation of mucosal layer into the muscle layer. This is the muscle layer. So this outpouching or herniation is called a Rokitansky-Eshov sinuses. Coming to anatomical relations. The gallbladder is entirely surrounded by peritoneum and is in direct relation to visceral surface of liver. It is in close proximity to the following structures. Anteriorly and superiorly we can see the inferior border of liver and the anterior abdominal wall. Posteriorly we can note transverse colon and the proximal duodenum. Inferiorly there is biliary tree and remaining parts of duodenum. Here you can see superiorly there is liver. This is the gallbladder, and below the gallbladder or posteriorly and inferiorly there is transverse colon. This is transverse colon, and here is the duodenum. Coming to the vasculature. The arterial supply to the gallbladder is via cystic artery. It is a branch of right hepatic artery. The venous drainage of different parts of gallbladder is different. The neck of the gallbladder is via cystic vein. The fundus and the body of gallbladder flows into the hepatic sinusoids. In this image, you can see the cystic artery which come from right hepatic artery here. Lymphatic drainage. The lymph from the gallbladder drains into cystic lymph nodes. The cystic lymph nodes empty into hepatic lymph nodes and ultimately celiac lymph nodes. The arterial supply, cystic artery, the vein drainage, cystic vein, and lymph nodes, cystic lymph nodes. Easy to remember. About the innervation. The gallbladder receives parasympathetic, sympathetic, and sensory innervation. The celiac plexus supply parasympathetic and sympathetic and sensory fibers. The vagus nerve delivers parasympathetic innervation. Here you can see the clinical relevance of gallbladder. There is a condition called gallstones. The gallstones are otherwise called cholelithiasis. Lithiasis means formation of stone, chole means bile. Hence it is called gallstones. They are small lumps of cholesterol, bile salt, or a mixture of these two. They are relatively common and often asymptomatic. Sometimes they may produce symptoms such as pain, jaundice, and systemic upset. In this case, doctors may do removal of gallbladder, and that is called a cholecystectomy. This is the picture of gallbladder with the gallstones collected in it. Thus, we have discussed macroscopic and microscopic anatomy of gallbladder. Thanks for watching. If you haven't subscribed, please do it and share with your friends.